This is Mon Health Talk, a weekly program focusing on the dedicated physicians, nurses, and staff at Mon Health, the region's premier community hospital system. People with skillful hands and bright minds using state-of-the-art technology. We don't just practice medicine, we care for people like family. That's why at Mon Health, you can feel the difference. Once again, welcome to this edition of Mon Health Talk.
Good morning. Welcome into the program. Dave Wilson and Sarah Giosi with you. Good morning, Sarah.
Good morning, Dave.
And back by popular demand, Dr. Wissam Gharib joining us in studio, an interventional cardiologist at Mon Health Heart and Vascular Center. Good morning.
Good morning.
All right, coming up this morning, we're going to talk about structural heart issues, if I've read the notes correctly this morning. And we're going to get into all of that. But first, just in case you need a refresher on Dr. Gharib, I'll let him do the honors and give us a little reminder on your background, where you came from, and what you handle over at the Mon Health Heart and Vascular Center.
Fantastic. So I've been in Morgantown since 1990. I did my training at WVU, internal medicine, cardiology, interventional cardiology. And I've been at Mon Health now for about 2 years. Really started clinically about a year ago. So I'm an interventional cardiologist who specializes in structural heart. And we'll talk about that today. But basically, we do a lot of the complex type of cases where patients have need for revascularization with balloons, stents, having heart attacks, etc. But also, we subspecialize in structural heart, which we'll talk about today. And basically, it's the next step of interventional cardiology, where patients have either a valvular issue or a hole in their heart, etc., and we fix those.
I was going to ask the obvious question here, because it seems like the title kind of explains itself, but when we're talking structural heart issues, we're talking about the physical structure of the heart, right? Valves, and et cetera. Valves is pretty much all I know.
I was waiting for you to throw out some more medical terms.
Well, I know aorta. I know that's in there somewhere. Chambers. I know that's part of the heart.
This is why we bring you guys on, because we are very ignorant. We're decent at radio, but don't put us anywhere near anything medical.
Oh, please, no. So structural issues. What are we talking about?
Yeah, so when you look at the heart, it's only one organ, but it's very complicated, as you would think. So, there's an electrical side of the heart. There's a coronary side, which is how you get the blood flow to the heart so it can do its work. And then there's the actual structures of the heart. So you have, a heart with 4 chambers, and with those 4 chambers come 4 valves to keep the blood in each chamber as it progresses, as the blood flow progresses through the heart. So a structural heart is talking about the actual valves of the heart, talking about the actual chambers, and each chamber needs to be completely separated from the other chambers. Sometimes that's not the case. We either have a hole in our heart, like a PFO or an ASD, that's a hole in the heart that's allowing communication between chambers that shouldn't be allowed. That's one part of structural. Another part, as we get older, those valves start to deteriorate. And as they deteriorate, they need either fixed or replaced, and that's where we come into play. Now, traditionally, this was only done with open heart surgery. That was the only way to get in there and fix either a hole or replace a valve or repair a valve. But now, with technology and medicine coming along so far, a lot of these can be done without the open surgical procedures in a minimally invasive way.
I was just going to say, so it's minimally invasive to get in there and fix potentially a hole in your heart. I mean, that is just, to me, so mind-blowing. So how do you do that?
Yeah, I mean, it truly, even though I do this every day and I've been doing it for many, many years, it truly is mind-boggling. And it's just different ways of getting these major prostheses placed in a very small tube or an elongated tube, and we're able to deliver them to the heart, deploy them, make sure they're where they're supposed to be, they're functioning, and if everything is good, release them, and then pull everything back out. And all these are done through a very small hole usually, or a very small access site.
Can you talk to us a little bit about, and we'll get into all of the, symptoms and signs, and if somebody's listening, should they reach out to you and all of that. But talk to me, if somebody knows that they need to have a procedure like this, what does the pre-op and post-op look like? Because, again, whenever I think about something as severe as a hole in the heart, I think, man, you're going to be out for the next year of your life. But that's not necessarily true anymore either, right?
Exactly. Now, it used to be true. You would need to spend several hours in the operating room, several days recovering in an ICU, and then about a week recovering in the hospital. But a lot of the things that I'm talking about, most of these patients are actually home either same day or next day, which is pretty crazy.
Yes.
And again, this is only in the last couple of years. A lot of these things that I'm talking about have only come to be over the last decade or last several years in some cases.
We're talking to Dr. Wissam Gharib this morning, an interventional cardiologist at Mon Health Heart and Vascular Center. We'll continue the conversation on the other side of the break. You're listening to Mon Health Talk on WAJR. Dave and Sarah being joined by Dr. Wissam Gharib joining us in studio, an interventional cardiologist at Mon Health Heart and Vascular Center. We're talking structural issues with the heart this morning. And during the break, Dr. Gharib, you were describing some of the imaging technology used to actually see the heart and diagnose it. And you said it is better than if you could literally reach in, pull it out, take a look at it, put it back in and work on it. This technology is better to help diagnose these structural issues that you can go in with minimally invasive procedures and fix now.
Correct. Because when you're actually looking at a structure with your bare eyes, you can only see the surface. But the beauty of some of the newer technologies we have, such as the MRI or the echocardiogram with the 3D capabilities, you can actually you can see the surface, but you can actually go through the structure and look at it from the other side. And that's what really makes it so neat, because a lot of the heart structures, all of the heart structures, are really a 3D structure, and the only way to best diagnose it and treat it is to actually understand what you're getting into. And that's where these newer imaging technology is very, very helpful.
And speaking of new technology, you recently got a new MRI machine, right?
Correct. We just got this over the last several months, and it really has been an eye-opener for some of these patients that are an anomaly, where we're not sure exactly what's going on with them. And it really helps us differentiate. Does the person have a scar? Do they have inflammation in their heart? What's causing the problem that they're having? And it really is a true eye-opener. You know, one of the newest machines in the country, and it's really nice.
Are you typically dealing with patients who have had heart attacks, who come in with chest pains? What kind of patients are you usually working with?
So we truly are a full-service heart center. So the Heart and Vascular Center at Mon deals with the whole spectrum. Something as simple as treating somebody's cholesterol and their blood pressure, to something as complex as treating a very complicated structural heart problem. Recently, we had a patient who had a double problem. She had coronary disease, which we stented. She had mitral valve disease as well as aortic valve disease, which we replaced, and all were done percutaneously, with the patient basically spending very little time in the hospital, all staged at different times, but the patient was able to basically get all those things done and go home without having her chest cut open.
A one-stop shop. I mean, seriously, though, you don't have to go to 15 different specialists all over the country to take care of all of these different issues. You can go to one place.
Correct. I mean, some of the things that we're doing previously were only available at major medical centers scattered throughout the country, but we're able to offer a lot of these things right here at home.
And so, again, as we're talking about the ideal candidate for what you're talking about with structural heart disease, where do folks start? So I would guess they start because they have certain symptoms, and then as you get to know them, you can say, actually, we need to come into this category. Does that sound right?
That does sound right. So the ideal candidate would take about a half hour to an hour to just discuss which ones they are, but I'll just briefly go through them.
Sure.
So if you're talking about somebody who has aortic stenosis, they usually present with shortness of breath, and they have a murmur that's heard in their heart, and their cardiologist or primary care doc will order an echo and say, oh my goodness, you have an aortic valve that's not working, and that's when they would be referred to us. Their main symptom usually is shortness of breath. If you have a hole in your heart, it's a little different. It could be shortness of breath. It could be a small stroke that you had, and then we are able to make the diagnosis and treat it. If you're talking about a watchman, such as somebody who has atrial fibrillation, who has a bleed, or is intolerant to taking the blood thinner that you have to take with atrial fibrillation, those people may not have symptoms such as saying, I need my appendage closed, but they have symptoms such as bruising, falling, unable to take long-term blood thinner. Those are the people we would put a watchman in. And then so on and so forth. There are other things like mitral valve. If you have a really leaky mitral valve from shortness of breath, then they come in, see their doc, and they get the diagnosis, and then we're able to treat.
All right.
Actually, I have a call coming in. Judy's got a question for Dr. Gharib about the heart. Good morning, Judy. What's your question?
Dr. Gharib, I have a grandson who's 20 years old, and he has his heart rate is usually 100 to 124. He is, but when he gets up and does exercise or walks out in the yard and does a little bit of work or whatever, his heart rate goes up to like 179. And then when he comes back in to rest, it goes back down to like 134, 145 or something like that. I just don't understand what's happening there. Someone says that he needs deconditioning, and
So
I really don't know.
That could be a lot of different things. So the best thing to do is have him seen probably by a cardiologist, probably have a monitor placed while he's doing these types of things. And there's multiple different ways that we do this. We can actually do it in-house with a stress test where we're looking at what is their heart rate response when we stress them. Or he can wear a monitor where we can see what's going on when he does these things at home. And that helps us to determine, is it a arrhythmia, or is it just a normal function of someone who doesn't normally exercise, or someone who has some sort of electrical disturbance in the heart. So it could be any of those things, and really the best way is to either, to definitely see a cardiologist and then try to figure out what it is that he's having. Because a heart rate of 179 may be completely normal for a 20-year-old, but may actually be abnormal in a 20-year-old that has an arrhythmia. And it just really, we have to differentiate the two.
Hey, Judy, thank you very much for the call. This would be a good time to ask the question. If people do need to get in touch with the Heart and Vascular Center, obviously, your primary care physician is your first line of defense, if you will. But if they want to get more information, want to get in touch with your office, where can they find out some more info?
So our website will really direct them. The phone number to the clinic is readily available. I think it's 598-8802. I hope I'm right about that. I was relying on big
It's on
trouble.
the website, though.
It's on the website. But the website is really going to give you a lot of information about who we are and what it is that we do. And I think that's the best way to do it. But your primary care doc is the source, and to ask for us, and we're able to arrange everything.
Dr. Wissam Gharib joining us in the studio this morning, an interventional cardiologist at Mon Health Heart and Vascular Center. We'll continue the conversation and wrap it up on the other side of the break. 8:50 Mon Health Talk on WAJR. Dr. Wissam Gharib joining us in the studio, an interventional cardiologist at Mon Health Heart and Vascular Center. I find you very pleasant. I think you're pretty entertaining.
There you go. You've got Dave's endorsement.
Here's the but. But how can we avoid having to come see you?
Yeah, it's true.
Because, quite frankly, I'd rather avoid any even minimally invasive heart surgery.
Yeah, that honestly is the best question, and that's where I really think you don't want to see me, okay? How do you avoid seeing your cardiologist? The best thing that you can do is what Mom told you when you were young, and these are, eat right, exercise, and not just those simple statements. So what do we recommend? When a patient comes to see me and they're young and I tell them this is not their heart and they're fine, the recommendations from the American College of Cardiology and from the American Heart Association, as well as the European Society of Cardiology, is telling us the following. So your exercise, how much should you exercise? 150 minutes a week. So that's 30 minutes a day, 5 days a week. And what does that mean, exercise? That means getting your heart rate up to 80% of where the maximum is and keeping it there. So not just, if it's walking, it's a brisk walk. It's a light jog. It's an elliptical. It's a bike, whatever. Get your heart rate up for 30 minutes. Keep it up for 30 minutes. Do that 5 days a week. That would be a good start. Diet, there's a lot of fad diets out there. What you want to do is have a balanced diet. You have to have fat in the diet. You have to have carbs in the diet. You have to have protein. A lot of people go on a lot of these fad diets, but you want a balanced diet, but also keeping your weight within check. Those are the types of things that can keep you from seeing me. And I mean, that's what you want. You want to try to avoid going to a physician, to a cardiologist. However, some of these other things just have to do, because we are doing such a good job as the medical care of the community, where people are living longer. And some of these issues with structural heart, unfortunately, are not due to your diet and exercise.
Father Time's undefeated.
Yeah.
You can't beat him.
Right.
Even if you, miss Sarah over there, whose diet is impeccable, owns a gym. Well, you're looking at me because you know my diet's not impeccable.
I was taking notes for you over here. Did you see that? I was.
But some of the things you're talking about, things will just deteriorate over time, and there's nothing you can do about that. If I'm hearing you correctly.
Structurally, for sure.
Yeah, from a structural heart perspective, unfortunately, AFib is a disease of older age. Aortic stenosis is a disease of older age. Some of these mitral valve regurgitations are due to just a mitral valve that just isn't constructed properly, or a hole in the heart is something you were born with. You rarely will develop that. That's something you're actually born with. So the structural heart is a little bit different. It's not so much due to things that you did. It's just either time as we get older, or other things like something you were born with.
Is that hard to get patients to come to grips with? I guess that would be a sign you have to admit you're getting older. At some point you go, well, doc, I eat right, I exercise, I'm doing everything I'm supposed to be. Well,
Yeah,
you just have to shrug your shoulders there and go, well, you're 92. What can I say?
exactly.
That's what we have to tell my wife's grandmother. You're 95. What can we say?
Unfortunately, that's exactly right. That's true. It's just a process of getting older. And, thank God, a couple years ago, there was nothing you could do.
Exactly.
Where now you're able to do something and get them right back on their feet, and they're fishing, they're going out camping, they're doing things that they really shouldn't be able to do at their age with the disease that they have. But because of today's technology and the way medicine has gone, you're able to do these things in a minimally invasive fashion.
We've reached the portion of the show, Sarah, where we have to remind folks that you can have all this done in Morgantown.
Yes.
Just down the road. You don't have to go to pick your favorite major city. Pittsburgh, D.C., New York, Cleveland. I mean, nobody wants to go to Cleveland anyway, let's be honest. You can have this done in your own backyard. And like you've hit on a couple of times here, we're talking a day or two versus 10 or 15 years ago, maybe even a couple of years ago. It could have been an extended stay.
No, you're 100% right. But I want to be clear. We will send people out if they need to be sent out. The point is, we've made a commitment at Mon. If it can be done better somewhere else, we're going to send you somewhere else. So we're either going to be the best or nothing. So if we can't do it better than anybody else or as well as anybody else, then we're not going to do it. We'll send you to the best place, because that's what you would expect for your family. That's what we expect for our patients.
I love that. And again, yes, we have the big city technology, but we also have the person behind it in a way that I think you don't get in some of those other much larger institutions. We've got a community feel, we've got a family feel. They can come, they can really get to know you as a person, or any of their physicians as a person at Mon Health. And I think that's a big piece to it, especially perhaps as you're getting older.
Dr. Wissam Gharib, interventional cardiologist at Mon Health and Vascular Center. Thanks for coming in this morning.
Thank you for having me.
You have the honor of being the first repeat guest. Did you know that?
No, I didn't. That's
I
great.
think there's a prize involved with that somewhere. I think it's a bag
I think
cup
that
of
was
coffee.
it. He got to be here with us a second time.
That's all you get. Just that great honor. Hey, appreciate you stopping
thing.
by this morning.
Thank you.